14 weeks pregnant, what to expect? At 14 weeks, your baby is now about 8.5 centimeters long, that's almost as big as your iPhone. At the start of trimester 2, she'll start to use her facial muscles to smile and grimace, and will have fully developed genitals. Here's all you need to know about what your baby and your body is doing at 14 weeks pregnant. What's my baby doing at 14 weeks pregnant? Your baby is now standing up straight and her neck is getting longer, helping the head stand more erect. At 14 weeks, your little one could be growing some hair, although her hair color might not be determined until birth and her eyebrows are filling in. At this stage, your little one will also have hair all over her body called lanigo, which helps keep her warm. Luckily, this will disappear later in pregnancy, once she gets some more body fat. Around now, your growing baby will have her first wee. As she starts to swallow little bits of amniotic fluid, they will pass into her stomach. The kidneys will start to work and the swallowed fluid will pass back into the amniotic fluid as urine. Although she gets all the oxygen she needs via the umbilical cord, at week 14, your baby will start to practice her breathing, an important skill for when she's born. Other developments this week include the development of the roof of your baby's mouth, and her intestines will start to produce meconium. This is the substance that makes those first few nappy changes black and tar-like. Other facts to know about your baby in week 14. Size-wise, your little one is around 8.3 centimeters long or around half a banana in length, weighing 43 grams. A male fetus can get erections in the womb from 16 weeks. Fingerprints have formed on your baby's tiny hands. What is my body doing at 14 weeks pregnant? Welcome to trimester 2. This is the time most pregnant women enjoy the most, and there's a few reasons why. You'll probably feeling a bit more like your pre-pregnant self, the morning sickness should have eased off and your breasts, hopefully, aren't quite as tender. Even better, this week, you'll probably start noticing that cute baby bump. Your uterus is finally rising out of the pelvic region and into your low abdomen. You'll have started producing more blood from the beginning of your pregnancy, but from around now, there'll be more blood cells as well as fluid in the bloodstream. This can cause swelling, so you might notice your rings feel tighter and your legs and ankles look like you've been on a long-haul flight. For some women, around this time of their pregnancy they'll experience round ligament pain. This is a fancy way of saying pregnancy growing pains, which will feel like achy or sharp pains on one or both sides of the abdomen. This is normal, and is caused by the ligaments supporting your womb stretching and thinning out to accommodate the increasing weight. You'll probably only notice it when you're getting up, stretching or twisting, and the best way to get some relief is by putting your feet up in a comfortable position. Facts to know about you in week 14. In the second half of pregnancy, your baby will urinate half a liter and every 45 minutes. Over the course of the pregnancy, the uterus stretches from the size of a peach to roughly the size of a medium watermelon. Even in pregnancy, hearing a baby cry can release oxytocin, which causes your milk-making cells to contract. Nasal congestion is commonly experienced during this stage of pregnancy by 30% of women. 14 weeks pregnant symptoms. Catching a cold. Just when a few of your symptoms started to ease off, the second trimester brings a whole host of new ones to worry about. One of these is being more susceptible to colds and flu. At the moment, your immune system is weaker, but this is a good thing as it stops your body from rejecting your fetus. On the other hand, this makes you more likely to pick up bugs, so be sure to wash your hands and carry hand sanitizer whenever you go. If you do feel like you're coming down with something, get in touch with your GP as soon as you can. Increased appetite. Now you've stopped feeling so sick, you feel constantly hungry. Remember to continue to eat healthy meals throughout the day. And avoid binging on sugary snacks, no matter how much your baby is craving them. Varicose veins. These are large, swollen blood vessels which show up on your legs. Although they might not look too nice, they are caused by the extra blood your body is producing to look after your baby. Minimize the appearance of these veins by keeping the blood circulating around your body by walking throughout the day. Stuffy nose. The high levels of estrogen and progesterone cause the mucous membranes in the body, including the nose, to swell and soften. This can leave you with a stuffy nose, but rest assured, it's normal.